Hey, everyone. So it looks like Pope Francis is back in the hospital.
Yeah.
And a lot of you are wondering what's going on.
Yeah.
And we are too. We're going to take a deep dive into this CBS News report about it today.
It's definitely, concerning. This is his fourth hospitalization since becoming pope back in 2013.
Yeah.
And when you consider he's 86 years old,
Yeah.
and he has that history of respiratory issues.
Yeah, CBS mentioned that he even had part of his lung removed when he was younger.
Right. That's a big deal.
I mean, how does that even...
Yeah, it reduces your lung capacity and can make you more susceptible to infections and complications.
Oh, wow.
Doctors have to be really careful managing any kind of respiratory problems he has.
Oh, absolutely.
Yeah.
So let's get into it.
Okay.
CBS says that Pope Francis went into the hospital on Friday, a Gemelli hospital in Rome.
Mm-hmm.
Initially, it was reported as bronchitis, but now they're saying it's a polymicrobial respiratory tract infection.
Right. And that's important that they change that wording.
Yeah.
Bronchitis is usually caused by, a single virus or bacteria. A polymicrobial infection means there's multiple microbes involved.
So they're not just fighting one thing.
Yeah. And that can make treatment a lot more challenging because you have to target a broader range of pathogens.
So it's more complicated than just finding the right antibiotic?
It's not that straightforward.
Okay.
First you got to identify all the different microbes that are there, which can take time.
Right.
And then different microbes might respond to different antibiotics. So you're trying to find a combo that works on all of them.
And doesn't
have bad interactions or side effects.
Right.
And then you have to factor in his age and overall health.
Yeah. They also use the phrase complex clinical picture,
Mm-hmm.
which I guess means there might be more going on than just the infection itself.
Right. That's usually doctor speak for
Sure.
something more serious is happening.
Like what?
It could be underlying conditions, complications.
Yeah.
We don't really have all the information yet,
Right.
which is why it's a little concerning.
Right. It's starting to sound a little bit like a medical mystery.
Yeah, a little bit.
And the report doesn't really say anything about the specifics of his lung surgery,
Yeah.
which seems it's something we should know.
Yeah. I mean, it would be helpful to know more about how much of his lung was removed
Yeah,
and what kind of lingering effects that might have.
absolutely. So this hospitalization is already longer than when he had pneumonia back in 2023,
Right.
which was a pretty big deal at the time.
Yeah. And that's why this is getting so much attention.
Yeah.
It's going on longer than that, so it makes people think, okay, maybe this is more serious than we thought.
Uh-huh. And there's been a lot of events that have been canceled,
Yes.
like a meeting with some artists at Cinecittà and maybe even his weekly general audience.
Right.
And there was supposed to be a deacon ordination ceremony.
Yeah.
It's not something you hear about every day.
Well, they're clearly taking this pretty seriously.
Yeah.
Canceling all those events.
Right.
It seems like they wanted him to focus on recovering.
Yeah. And that deacon ordination seems like a big deal
It is.
to cancel that.
Yeah. That's a ceremony where he formally confers holy orders on new deacons.
Oh, wow.
It's a major part of his role as head of the church.
I see.
So if he misses that, it really kind of underlines how serious this is.
Yeah, I would say so. I mean,
It means his health is preventing him from doing essential parts of his job.
right.
And that brings up a whole other question.
Which is,
What happens if the Pope's just too sick to do his job?
right. Huge question. We'll get to that later.
We will.
CBS also mentioned that Pope Francis insisted on finishing his morning audiences before going to the hospital,
Ah.
even though he was apparently having trouble speaking.
Oh, wow.
I mean,
That sounds like Pope Francis.
yeah,
He's very dedicated.
he is.
He always puts other people first.
Right.
Very humble.
But that also makes you wonder if maybe he was downplaying his illness.
Yeah, it's possible.
Maybe he should go to the hospital sooner.
It's possible that he was trying so hard to keep his commitments that he ignored how he was feeling.
Yeah, it's a tough balance. You want to serve the people, but you also need to take care of yourself.
Yeah, especially when you're the Pope.
Yeah, there's a lot of pressure there.
A lot of pressure.
So we've got dedication, we've got potential delayed treatment, and we've got this huge question about what happens when a pope is too sick
Exactly.
to do his job.
Big questions.
So much to unpack here.
Lots to think about.
But before we get into all that, let's look back a little bit.
Okay.
Have there been other popes who faced similar health challenges?
There have. There's a lot of history there.
Okay, so let's dive into that after the break.
Sounds good.
We'll be right back with more of this deep dive on Pope Francis's health and what it might mean for the Catholic Church.
All right.
Welcome back. So before the break, we were talking about, how this hospitalization is already longer than his pneumonia scare back in 2023 and all those canceled events. And you were saying that looking at other popes who had health problems could give us some perspective.
Yeah, definitely. For example, Pope John Paul II, he served from 1978 to 2005,
Yeah.
and he had all sorts of health issues.
Right.
Throughout his papacy, Parkinson's disease,
Mm.
the assassination attempt, surgeries, I mean,
Oh.
his health was declining very publicly.
Uh-huh. And it made people really start to question,
Yeah.
what does it mean to be Pope?
Right.
Can you step down? Is that allowed?
Exactly.
Oh.
And, John Paul II, he chose to stay in office,
He did.
even though he was clearly struggling.
Right.
And that really shaped how people saw the papacy.
Yeah.
It reinforced this idea that the Pope is like a spiritual warrior,
Wow.
enduring suffering and leading by example, even when it's really tough.
That's a lot to live up to.
It is.
Especially for Pope Francis, who's, in his late 80s
Yeah.
and dealing with these ongoing health problems.
Right. It makes you wonder if that model of papal leadership is even sustainable anymore.
Yeah.
I mean, things are different now.
Right.
We have all these advancements in medicine.
Yeah.
And people are more aware of the importance of taking care of themselves, both physically and mentally.
Yeah, it's not like it used to be.
Exactly.
Plus, we can't forget that Pope Benedict actually did resign back in 2013.
Oh, yeah. That was huge.
I mean, that really changed things.
Totally. It set a modern precedent for stepping down as Pope
Yeah.
and opened up this whole new way of thinking about the role.
It's like it acknowledged that even the Pope is human,
Exactly.
subject to the limitations of, age and illness,
Right.
and maybe stepping down is the best thing for the church.
Right. Sometimes it's better to have a smooth transition of power
Mm-hmm.
than to hold on when you're not really able to do the job effectively.
Right. It's about putting the church first.
Exactly.
So now we're looking at Pope Francis and we're seeing all these parallels.
Yeah.
It's not just about his personal health.
It's not.
It's about what's best for the whole church.
For all 1.3 billion Catholics worldwide.
Right. It's a huge responsibility.
It is. And as we learn more about his condition and how it might affect his ability to do his job,
Uh-huh.
those questions about the future of his papacy are going to keep coming up.
Absolutely. So we've talked about history and resignation and this huge weight of leading the church.
Mm-hmm.
But let's go back to Pope Francis's current illness for a minute.
Okay.
Before the break, you were explaining how tricky it can be to treat a polymicrobial infection.
Yeah.
And the CBS report just says he's receiving drug therapies.
Right.
Do we know anything about what that actually means?
Not really. They haven't given any specifics.
Okay.
But, thinking about his age and the lung surgery and everything,
Right.
he's probably on a bunch of different meds,
Yeah.
carefully chosen for his particular situation.
Like a personalized drug cocktail.
Pretty much.
Wow. So what are some of the challenges doctors might face treating someone like Pope Francis?
Well, like I said, polymicrobial infections often need a multi-pronged approach.
Uh-huh.
Different drugs for different types of microbes.
Right.
And that can increase the risk of drug interactions and side effects.
Especially in someone his age.
Exactly. Older patients are usually more sensitive to those things.
Right.
And then on top of that, they have to consider his reduced lung capacity
Oh, yeah.
and any vulnerabilities from the surgery.
It's like they're walking a tightrope,
I got it.
trying to be aggressive enough to fight the infection, but also making sure the treatment doesn't do more harm than good.
Yeah, it's a delicate balance.
And all this is happening with the whole world watching.
No.
I mean, every little detail about his condition is making headlines.
Right, and that can't be easy for the doctors.
No.
Knowing that millions of people are scrutinizing their every decision.
It's like a medical drama playing out on a global stage.
It really is.
And it's not just about the medicine.
Yep.
They have to manage all the information coming out,
Right.
deal with the public's concerns, figure out how to be transparent without violating his privacy.
It's a lot to handle.
It really is.
Yeah.
It's easy to forget that at the center of all this
Yeah.
is a human being
A real
facing a serious health challenge.
and a team of doctors doing everything they can
Yeah.
to help him.
And a community of faith that's worried about him.
Absolutely.
Okay.
It's a powerful reminder that these news stories, they're not just abstract things.
They're real people's lives
Exactly.
playing out on a global scale.
With huge implications.
Yeah, for the Catholic Church and beyond.
And as we keep watching this story unfold,
Yeah.
there's one big question that looms large.
What's that?
What would a papal succession even look like in this day and age?
Right. It's a process shrouded in tradition and secrecy.
Exactly.
Right.
Let's dive into that.
Okay. All right. So we're back, and you were just about to give us a little peek behind the curtain of papal succession.
Yeah, so basically, when a pope either dies or resigns, the College of Cardinals gets together
Okay.
and they hold a conclave to choose the next pope.
So it's like a super exclusive papal election.
That's a good way to put it.
Are there rules about who can be elected?
Technically, any baptized Catholic male is eligible, but realistically, it's almost always one of the cardinals.
Okay, so they're all cardinals appointed by the Pope.
That's right. They meet in total secrecy.
No outside contact.
Nope, completely cut off,
Ah,
and they keep voting until someone gets a two-thirds majority.
that sounds intense.
Oh, it is. There's a ton of pressure.
I bet. They're choosing the leader of over 1 billion Catholics.
Exactly. And it's not just a religious role.
Right.
The Pope is a global figure
Uh-huh.
advocating for peace and justice
Right.
and trying to build bridges between different faiths.
And in the case of Pope Francis, they'd be following someone who's really shaken things up,
Yeah, he's definitely charted his own path.
pushing the church to be more inclusive,
Uh-huh.
more compassionate,
Exactly.
addressing issues like poverty and climate change.
Right. So finding someone who can carry on that legacy.
Yeah.
Someone who can deal with those complex issues with the same kind of boldness and sensitivity.
What's a tall order?
It is. It's going to be a real challenge for the Cardinals.
Yeah, they're going to be looking for someone who not only understands the faith, but also has the skills and the experience to lead the church in the 21st century.
And let's not forget, the world is going through its own turmoil right now.
That's true.
Yeah.
We've got political divisions, climate crisis, economic uncertainty.
So the stakes are really high.
Yeah. The next pope is going to be stepping into a world that's facing some pretty huge challenges.
A church with its own internal struggles
Right.
and a flock that needs guidance.
It's a lot to think about,
It really is.
but it's also fascinating.
It is.
We've covered so much ground in this deep dive.
We have.
Pope Francis's health, the possibility of him resigning, the complexities of treating this kind of infection, the historical parallels, the challenges of papal leadership, even how the next pope is chosen.
And we've only just scratched the surface.
Exactly.
That's what makes these deep dives so interesting.
Yeah.
It's not about giving all the answers. It's
Yeah.
about asking the right questions.
Sparking curiosity.
Yeah, encouraging people to think critically.
So what's the one question you hope our listeners will keep thinking about?
Good question. I guess it would be this. Given everything we've discussed about Pope Francis, his vision for the church, the state of the world today, what kind of leader will the Catholic Church need moving forward?
Wow, that's a big one.
It is, but it's an important one.
Absolutely. So much to ponder.
Definitely.
But that's all the time we have for today.
Right?
Thanks for joining us on this deep dive.
You got it.
Stay informed, everyone, and keep those questions coming. See you next time for another deep dive.